So we'll be recording this webinar as usual. I'm just going to wait a couple of minutes for people to join. I think quite a lot of people are on annual leave this week, so I've had quite a few texts from people, so I don't know. I don't think it'll be that busy today. Okay, everyone, we're just going to start in about a minute or so. So it's the 25th of August. Good morning, everyone. And I know it's a bit of a rainy day today, so hopefully it's going to brighten up. I think I've got a couple of things to cover, but actually you wanted to cover paediatric ultrasound this morning. Do you want to bring that topic up?
Yes, please. Yeah, thank you. So we had a bit of a problem because we were referring ultrasounds to Finchley Memorial and to Barnet General. And we got a message saying that they're not able to, because the ultrasound department in Barnet is so backlogged, they're not taking requests for ultrasound, and Finchley Memorial don't do under 16s. And so we were a bit stuck with, these kids with these persisting lymph nodes or lumps and bumps or whatever we need to scan, and we don't know where to send them. No one's taking paediatric referrals for ultrasound.
Absolutely, yeah. And I think you're absolutely right. It's a real risk, isn't it, for our patients? So just so everyone knows the background, ultrasound at Barnet and the Royal Free is no longer accepting GP referrals as of 2 weeks ago. And if you're sending them through, two things are happening. They're clinically assessing them, and if they think they don't have enough clinical details or they haven't been RAG rated, they're being sent back to GPs. If they think they've got enough information, they're forwarding it to InHealth on your behalf. To mitigate any clinical risk. Now, the issue is InHealth, as you quite rightly said, don't do children, and that is a real issue for us. So I have brought it up to NCL. I'm going to bring it back up on the NCL call today at lunchtime. So leave that with me. I'll get something back to you by Friday. But I think it's a real issue, so I will bring it up today in today's NCL call. I think that what I would recommend is that if you have an example, I think we should flag it to the quality team at NCL as patient examples. I think we should really we should flag it, because I think it's a clinical risk, and we should not be taking that clinical risk. We are GPs, and if we think that patient needs a scan, we should be able to access that scan. So I think we should flag it up, absolutely. So I think two things. My recommendation: email the quality team, and then leave it with me. I'll bring it up on the NCL call today at lunchtime, and I'll come back to you on Friday with an update. Is that all right?
That's perfect. Yeah, thank you. In the meantime, the desperate ones, we're trying to get through to the paediatric rapid access clinics and stuff, but it's not a great use of that service, to be honest.
Absolutely. Thank you for bringing it up.
Thank you. Thank you.
So this morning, the couple of things I want to update you on is just about the review of children and young people on the shielded list. So really just to remind people that, just to update that list. So there's some people that may need to be removed from that list. And really just to think about why we want to remove them is that if they need to be removed, then they can go back to doing things like schooling and other activities. So it's just to remind colleagues to remove them from the list. The things I wanted to update you on this morning was what has come out from the learning from recent outbreaks of COVID-19 in practices across NCL. And we've seen a couple of practices who have had COVID outbreaks, and what we've said is actually extra precautions should be taken in communal areas such as kitchens, staff, and communal and meeting areas. That's where we seem to be transmitting it from one another. So keeping 2 metres apart where possible in communal areas, well, that's not always possible, certainly in Barnet practices, because we've got quite small buildings. So what we're saying is when people are walking around in communal areas, they should wear a mask. But obviously it's not possible when we're eating and drinking. So what's really important, we encourage all of our staff to be washing our hands before and after eating, not sharing food with colleagues, as we might have done pre-COVID, not organising bring-in share parties or gatherings in the practice, storing food in sealed containers and then putting them in the fridge rather than open containers, and that's the key thing. The next thing that came out of the after review of the practices that had COVID was that infection can also be transmitted in waiting rooms. So the recommendation is if you're not using the waiting room, remove all the chairs from the waiting room. But if you are using the waiting room, make sure that all chairs are at least 2 meters apart from each other, and then somebody's cleaning those chairs on a regular basis. And then the final thing is hand sanitizer and face masks available for patients when they come in the building. And are people cleaning things like door handles, phones in the practice, so consulting room phones and keyboards. So certainly in our practice, we clinicians clean their desks, phones and keyboards every day, but our reception team are going around cleaning door handles every day, and chairs and things like that. I think these are the key things that we should be focusing on to mitigate the risk. The update I wanted to give you this morning next was about MSK. So as you know, I look after the community services. So staff have been redeployed to support the areas in MSK. And some of the staff from the MSK have gone to discharge to assess the integrated discharge team and inpatient rehab. So there's about 60% of staff have now returned to the MSK service, and they aim to have 85% staff returning in the next week, and then 100% of staff by the end of September within the MSK service. So that's good news. Now, what they're doing, they've got a new clinical triage that's happening for patients. And really what they're doing in that clinical triage is they're offering patients virtual advice to begin with. So they're triaging and they're providing educational materials independently so that patients can manage their conditions, and then they're following up patients, and then some patients are being offered a face-to-face appointment if necessary. Some people have asked me what are the leaflets that they're giving out. So I think what I'm going to do, I'm going to share with you in the chat bar the website that you can have a look at for CLCH MSKs. I've just shared that in the chat bar, and on that you'll be able to see a link to their website and the leaflets they provide for patients, because some have quite rightly said, well, if I'm going to refer a patient and they're going to just give my patient some virtual advice and a leaflet, I could do that, but it'd be good to have the resources that they're giving. So I've just shared with you the link in the chat bar for people that want to share those leaflets with their patients. So there is a strict criteria for face-to-face, but I think it's important that we recognise that a lot of patients will be seeing virtually right now. Last week I talked about flus, and I'll be talking about that again on Friday, and about logistics of delivering flu clinics. I'll be doing that on Friday. But this morning, what I wanted to tell you about was confirmation about what we should be doing for the 50 to 64-year-olds. You all should have probably seen the LCS that came out yesterday from NCLCCG. And I talked in detail about that last week on Friday. But the key thing that's been released is that we're being told not to vaccinate 50 to 64-year-olds at the moment in order to ensure that those who are clinically at risk are prioritised. So GP should not be inviting anyone in this age group unless they're in a risk category like asthma or diabetes. And their NCL are recommending that we put the following statement on any information that we give out to patients, and that says, please note that people in the 50 to 64-year-old age group will not be vaccinated until November and December, providing there is sufficient vaccine, and no appointments will be offered for this age group until then. This is to ensure that those who are most risk are vaccinated first. If you are 50 to 64 and you are in one of the groups that are eligible for the flu vaccine, for example, you have a health condition which puts you at risk from the flu, you'll be invited earlier. So what we are worried about, obviously, that there's going to be a shortage of vaccines because, those who are historically under 65 with a health condition, if you look at historical data in NCL, we've only been vaccinating about 40% of those patients. And so that is quite low actually. And so if you've only been vaccinating 40% of those patients, and we probably only ordered 40% of the flu jabs, we think maybe 70% of those at risk might turn up this year. We might run out of flu jabs. So I think that's the key thing why. Now, NHS England have said to us that they have a stock of under 65 flu jabs for us and over 65. They have not yet told us how many that is, but they are estimating that they will provide 50% of our eligible patients flu jabs as a backup than what we've ordered, but we're waiting for confirmation on that so we know the exact numbers. So hopefully we'll find that out quite soon. The next thing I wanted to update you about was LAS, the ambulance service. So there's an important update on the changes, what they are doing and how they're going to be recording patient details and treatment, and that will mobilise over September. So this is a particular change for us. So if you've ever seen LAS before, they fill out a bit of paper, and that often goes to the patient, and one bit of the paper goes to the hospital. What they're going to be doing now is moving to a system called ePCR, that's electronic reporting. And so they will be then doing their summaries on some sort of electronic document, and they will be sending that to us, a bit like a one-on-one summary. So it will allow us access to clear, concise and immediate digitalised record of treatment and any advice given by LAS, because often LAS go to patients and then don't take them to hospital, and often the observations and things are quite useful for us to have on our systems. They'll provide that as a unique summary to patients as well, and patients will have a summary number and a PIN so they can access the data online as well. And they'll be, if they take pictures of a skin lesion, they'll now attach that to the document. So let's say that a patient's called out because they've got a cellulitis, and they then take a picture of that cellulitis. That will be uploaded to the LAS notes, and when we send us a summary, we'll be able to access that. So I think that's really fantastic for us. So I think that's a good change coming, and they said it will be ready by the end of September. The final thing I wanted to update you about this morning was the changes to the fertility policy. So the fertility policy has been updated in line with NCL, so that the policy is standardised across NCL, and there are key changes to our Barnet policy. The first change is that we can now refer patients up to the age of 43, whereas our previous policy was 42. The next change is women aged 40, 41 or 42 will only be offered treatment if they've never previously had IVF treatment, however funded. Previously that was only 40 and 41, so there's a slight increase in the age there. What they've also said is referring clinicians should be aware of the workup time required by the providing trust, and our trust would be Guy's, and ensure that referrals are made in time for women to start their first treatment cycle before their 43rd birthday. Now, waiting times are approximately 6-7 months. So really what we're saying is we should be referring these patients at 42 and a half so that they get timely treatment. And the number of treatments to be, the number of cycles to be funded are really the same. So it's one full cycle of IVF with or without ICSI to patients aged 40, 41, 42 and have not previously had IVF treatment, however funded. And one full cycle will consist of one fresh and one frozen embryo transfer. So I'll stop there and I'll look at some questions. Martin, you said the link doesn't work. So what I'll do now, that link might only work if you're on a NHS computer. So I will send you another link to CLCH website, which you should be able to look at from home. And Nadine, you've asked a question about, has Barnet ED opened for paediatrics? Yes, it opened on Thursday or Friday last week. So Barnet paediatric A&E is now open as of Thursday or Friday last week. So that's really good news for the system as well. I understand, and I'm not sure the details, but there is discussion about closing other paediatric departments in NCO. I think the UCL paediatric department is going to be closed at some point, and Whittington is going to become a paediatric A&E hub. I think that's the plan for 2021. I know that's being worked out across NCL, secondary care paediatric consultants and trusts. So hopefully we'll find out more information on that in the very near future, and I can keep you updated. Charlotte, you've got a question?
You know, I think UCLH haven't actually reopened their paediatric A&E. So they're only open for, their ward is open for the haematology oncology patients, but they don't have an A&E open. But it's really good news for us that Barnet's reopened.
Yeah, absolutely. Thanks for that, Charlotte. Thank you. Yes, that's good. So yeah, absolutely. Thank you. Okay, fantastic, everyone. I've run over a little bit, so I'll see everyone on Friday. And if you've got any other questions, pop them in the chat bar. And otherwise, I will see you on Friday. And if there's anything else, pop it in the chat bar and I'll get back to you during the week. Have a good morning, everyone, and take care.
Thanks very much, Nick.
Thank you.